Obsessive Compulsive Disorder.
Obsessive compulsive disorder, we shorten it by saying OCD, so that's what I'll refer to it, is a disorder that involves having obsessions and compulsions. Kind of easy to remember. These are recurrent, intense obsessions, or what we call thoughts, and or compulsions, what we call acts or mental acts. Obsessions are persistent thoughts, impulses, or images that are unwanted. And it can be unrealistic and illogical. And the one suffering from it knows it is unrealistic and illogical. But they just keep happening, keep thinking about them. I'll give some examples later. Compulsions are repetitive behaviors or rituals or mental acts. And sometimes these are occurring as a result of trying to neutralize or reduce the obsessions. So that is the definition of OCD.
How common is it for a child to have this disorder?
This disorder can happen maybe 1 out of 200 children. According to the statistics of the diagnosis right now, children and adolescents, and it usually begins during the adolescent or young adult years. We don't usually see it very young age, but they tend to start to occur and then maybe even evolve, which means they can start having one kind of obsession or compulsion and then they might switch into other kinds. So sometimes they start off with maybe fear of germs, and it gets resolved and it becomes fear of something else.
Are there early signs that can help parents prevent it from worsening?
There are early signs that parents can be able to catch that it's starting to happen. For example, it is diagnosed formally when the obsessions and or compulsions, because in OCD you can have one or the other or both. And if those things take up the person's life up to an hour of their day, then it is diagnosed officially. For example, if the compulsions are increasing in the length of time or causing more distress, or the anxiety of not doing those compulsions worsen when somebody's trying to stop them or prevent them from doing it, then we know that it's becoming a real problem. For example, there might be an obsession of a constant worry that harm is going to come to themselves or their family. Or they're rechecking and checking, like door locks, or the stove is on or not, or if the car door is locked and they have to keep on going back out again and again. Or an obsession that they feel dirty or that they are dirty and they have to keep washing their hands. And sometimes it's the entire body, they have to keep showering. Or they think their bathroom is so dirty even though it's so clean, and they have to keep scrubbing and scrubbing. Those are some examples.
What can parents or teachers do when their child displays OCD behaviors?
First, I'd like to share what not to do. For example, let's try not to minimize. That means try to make it look unimportant. They are in distress with much anxiety about these thoughts or what they want to do for their compulsions. And many times adults don't understand that because it's kind of weird and illogical. So let's try not to minimize it or shame the individual, or even not to reinforce and allow it to happen even more. To just say, okay, then keep washing if you want to do that. And they will do it over and over, and maybe it'll increase to 2 hours a day. But what can we do? First, I would say to ask questions out of curiosity and giving them the space to feel comfortable to tell you. For example, what is it that you're afraid of? What is causing you to feel you have to do that? And it's okay to tell me. don't be ashamed. Don't be. I want to know what's going on. This will help them just kind of share and not feel like dumb about it or ashamed or embarrassed. Then, once you know it is OCD officially, you can help the child understand that it's a brain disorder, that that you know that they can't help it, that something is going on in the neurological process that is a little bit off and making them want to do that when they don't want to do that. That's what OCD is all about. There's a phrase that one of my clients shared with me. It helps her separate, to not be thinking that she's doing it or thinking it, but that it's the disorder causing it. And the simple phrase is, it's not me, it's OCD. It's not me doing this, but it's OCD. So they can start fighting against it, because majority of the times these are intrusive lies.
Can you give a few more examples of what OCD behaviors look like?
Yes, so I'll give you some examples even from what I've experienced and helped with. One was somebody who really thought that they needed to scrub their skin over and over and over again. So their showers can be very, very lengthy. So they would scrub and lather and rinse, and after they're done, it touched the side of the bar of the bathroom, and they thought, uh-oh, it's dirty. And they have to scrub and lather and rinse again. Can you imagine the distress about that? Another example, which looks odd, but they feel like something bad will happen to them unless they walk on the sidewalk and skip all the cracks. So they can't touch a crack. And if they do, they have to start all over and go back to the end of the street and do that again. And so that's another distressful one. I had another patient who was very unsure if she locked the door of her car and turned on the alarm. So she has to go back to the garage where her car is, and make sure it's locked and hear the beeping sound of the alarm, and then go back to her office. But once she gets to the office, she's unsure again and has to go back to the garage. So you can imagine this will take away minutes from her day of her work. Another one that's really interesting is mental acts and guilt that comes from a religious background. So somebody might feel maybe a sense of lust. They saw someone cute and said, oh, he's cute. But they felt very guilty about that on a spiritual level. And suddenly they have to wash it away from their thoughts. So they would have to do repetitive prayers, or they have to read a Bible verse over and over and over and over in order to neutralize that guilt or that thought. So that's another religious type. And there are quite a few examples. And one last one I can tell you is someone who is very obsessed about orderliness. And they take forever to put things in order. Even though to someone else's naked eye, they're looking at a painting and it looks straight to them. But the one with OCD will look at that and be so unsure, so insecure about that, and can't rest. So they have to go back to the painting, adjust to the center according to what they think, come back and look at it, and then do it again and do it again. Or their closet has to be in a certain order. The hangers have to be in certain distance between each other, or the colors have to be exactly in array of matching order, or all the buttons have to be closed or open, or like there's so many different obsessive and compulsive needs or impulses and urges that they have to keep. Otherwise, they can't breathe and relax.
What are typical treatments for this illness, and how effective are they?
Yes, there are treatments for OCD, and it should be treated. because if left untreated, some people's OCD worsens and evolves and becomes more problematic to the point of maybe even hurting themselves. So we do have to address it. At times it's not as effective, but we must always try and give the person hope. Now, the three areas I will talk about will be psychological treatments, medical treatments, and also how to approach this spiritually. Psychologically, it is the first line treatment. What that means is even before we give medications, and I'm a psychiatrist and that's what I mainly do, we always advise our clients to consider psychological therapies first. For example, the two top choices for OCD is cognitive behavioral therapy, CBT for short, and exposure response prevention therapy, ERP for short. And cognitive behavioral therapy talks about teaching the patient of how their behavior, for instance, compulsions, come from their emotions, feelings, which come from their thoughts or erroneous illogical thoughts. So we try to reframe and talk about the probabilities and how to correct those thinking in order to reduce the anxiety, in order to help reduce the behaviors eventually. In ERP, it is absolutely one of the most effective treatments. And it sounds a little cruel, but the client is exposed to their feared item. For example, they're afraid of germs. The treatment provider would guide the patient to sit in a situation that they think is somewhat unclean so that they can increase their distress tolerance. That means to be able to tolerate and to realize that it's not so bad. And in this case scenario, the longer they are able to do that, then the more delay they would have of their compulsions. Because many people, as soon as they think about that their hands are dirty, they can't handle that distress. They have to hurry up and go to the sink and wash and wash and wash and wash. So a lot of this training is very helpful, and it does take some time. The next level of treatment would be medications. Certain patients, they have such great distress and anxiety to the point where they get paralyzed from it. So we would use medications such as selective serotonin reuptake inhibitors, SSRIs, to help with this anxiety levels. And lastly, because we want to approach this most comprehensively, is to approach it spiritually as well. The OCD is about concepts of intrusive lies, okay? Lies that are coming in from outside to inside their brain and they can't help it. So these intrusive thoughts, Satan uses that to distract the person. And Satan uses that to make us distrust. For example, the mother or father would say, your hands are clean enough. You washed it like 3 times already. It's clean enough. But a distrust happens. And the child might say, no, it's not. Not until it's 100 times. And also Satan, the enemy, has a goal to destroy our joy and peace. That's pretty much what OCD patients go through. There's hardly any peace. And even after they, for example, wash 100 times, it's only short-lived until the intrusive lie occurs again and again. Therefore, with all of the treatments together, there's a lot of hope that improvement can be made. And sometimes the goal is not to get rid of something completely. There are so many Christians out there who feel that only if it's completely gone, I am fully healed, and so God loves me. But I think that's not correct to always hold on to, because even Paul, Apostle Paul, asked God, please take this thorn away from me, and God didn't do it. God showed him that my grace is sufficient for you, even if you have to live with that thorn for a little longer.